Hi, I'm Sam Whittle from Adelaide, South Australia, and I'm here at ACR 2018 in Chicago. I've been in the poster hall today checking out some of the posters looking at imaging in spondyloarthritis. There were a series of really interesting posters, and I want to bring you three take-home messages that I got from these. Most of this work is by Walt Maksimowicz and his colleagues, and it's looking at specifically at the role of MRI in the diagnosis of axial spondyloarthritis. So the first take-home message is in regard to the role of active lesions on MRI, such as bone marrow edema, versus structural lesions, such as erosions or fatty lesions. And so what we learned from one of the posters is that at diagnosis, bone marrow edema or activity lesions tend to be more specific, but the structural lesions tend to be, the bone marrow edema tends to be more sensitive, but the structural lesions tend to be more specific. The interesting thing is that if you follow these people over time, the diagnostic performance of the activity lesions doesn't really change, but the specificity and the overall diagnostic performance of the structural lesions improves over time, suggesting that as patients accrue more damage, the specificity of MRI structural lesions becomes even higher. The second take-home message looks at local readers of MRIs versus central readers of MRIs. That is, slightly less experienced radiologists versus radiologists with a particular interest in MRI diagnosis of spondyloarthritis. And not surprisingly, they found that the local readers were slightly more likely than the central readers to overcall the presence of bone marrow edema in early axial spondyloarthritis, suggesting that as we become more experienced in reading MRIs, we become a little bit more discriminating in what we call a real or important bone marrow edema lesion. And the third take-home message is looking at the performance of plain X-rays versus T1 weighted MRIs to look at structural lesions in axial spondyloarthritis. We've long known that X-rays have pretty poor diagnostic performance, but they're still really important to our day-to-day diagnosis in the clinic. This study looked at patients who had T1 weighted MRIs and X-rays in the same patient and compared their structural findings. Interestingly enough, there was pretty poor agreement. The kappa was only 0.39, and indeed fewer than half of the X-rays that were reported as meeting the modified New York criteria for sacroiliitis actually showed any structural change on the T1 weighted MRI. So I guess what that means is that either the X-rays are a much more sensitive modality than MRI, which they're not, or X-rays really are not a very good diagnostic tool. So what do we expect in the future? Well, we expect to see the rise of MRI as a tool, and perhaps we expect to see the demise of plain X-rays. So if you want to learn more about this and everything happening at this meeting, don't forget to go to RheumNow.com.